We live in a nation filled with constipation, and today we're going to talk a little bit about that problem and how to solve it, especially some of the big nuances. I'm Dylan. This is my co-host Robin, my mom. Say hi, mom.
Hello?
And this is the Lifestyle-Based Healing Podcast. So, mom,
Yes.
there's a pretty big constipation problem in the United States. There's a pretty broad way of defining what constipation is. We see in practice so many health issues start in the gut, and so many gut issues start with constipation. And so we want to talk about that. What are some of the things that you've learned about constipation or how you see in practice?
Yeah, I'm really excited to talk about this topic. It's honestly not something we talk enough about, and people are always a little surprised when we start working together and we talk about BMs a lot. And people get a little embarrassed,
What's a
but
BM?
a bowel movement, and you can call it poop, you can call it, whatever, but it's important because what goes in needs to come out, and that is a real reflection of our health, our and digestive health. And as you know, Dylan, we see a lot of digestive issues with a lot of our clients. They might come in for wanting to lose weight or managing their diabetes or navigating their autoimmune issues, or they might come in with inflammatory bowel disease or something like that specifically. But what we, if it's not a bowel issue, some of those other issues, we find that what goes along with it sometimes is, digestive issues. So
Yeah,
it's a
it's not just a
really,
handful of people. Actually, 15 to 16% of the US population is affected by constipation. At least that's the official stats. I think it's probably way more. People just don't realize that they're constipated.
yeah.
It gets worse with age and it's actually more common in women than in men. A lot of times people come in and, when we start to bring up these constipation issues, like they have all sorts of questions, right? And so what are some of the main questions you get?
Well, the main questions I get, and first of all, this is not meant to be medical advice. We really just want to educate you so you can have this knowledge and go back to your doctor and have these conversations. But a lot of times people will obviously know, hey, I'm not pooping enough. Okay, they really, they know constipation's going on. And interestingly enough, often people say this has been an issue for 20 years or all my life. Ever since I was a kid, I had problems going to the bathroom, right? And so it follows them, and so it can be a big problem, and you can know about it, but there's some things that you may not know about, like, you start having, a lot of gas or bloating and nausea, lack of hunger, loss of appetite. You get full really quickly. I've heard that a lot. But it's like, I just get full so quickly, but then I'm hungry shortly thereafter. Of course, the heartburn, acid reflux, the diarrhea. This is a big one, is that people have this diarrhea and it never occurs to them that it might start with constipation. And then I've heard of people saying I have pain down low in my colon, and so they know something's going on, but they're not really sure what it might be. And so the one that I think surprised me the most is how fatigue plays into this. And so when I think about constipation, to me, it means that the microbiome, all those little microbes in there, are unbalanced. And that's something we need to address. But, it really can, the thing with constipation, it can be very nuanced for sure.
Hmm. How often should I be pooping?
It varies, and this is the thing. It's so individual, and I think, I don't know, daily, or some people go multiple days without going. Some people go 3 times a day. I hear it's all over the board. So I think it's different for everybody. And this is where one of those nuances happen, right? I think the bigger question is, am I having symptoms? The bloating, the nausea, the, pain, the gas, those sort of things that might be indicating that you're not going enough.
How
And
should I
so I
feel if
think
I'm going enough?
you
Like
should
how do you
feel
feel?
cleaned out. Okay. You shouldn't have any of those symptoms. You should feel like what's going in, coming out. The normal transit time is roughly 12 to 24 hours. So if you're, I guess if you're in that range, but it's again, it's very individual. And so if you're in that range, you can probably go, all right, things are moving through well enough. Okay.
Does it also depend on what I eat?
A lot of times it does, yeah. Yeah. I mean, so I think that of course people always want to lean into fiber and that's a great thing. And to keep things going, I think things that stop people up more are those high fat, those fatty foods, ultra processed foods, those sort of things. And um, things get kind of plugged up. And then that's when the problems start to happen is they get kind of this blockage, it's more of a log jam. And then, things don't move through as fast or as quickly as they should. And I think that's when the symptoms start to happen. I
Mm.
think uh, one of the biggest things I see people come in, this is how I was trained as a dietitian. You always ask about people's bowel movements, and if they tell you they're going daily, you figure things are going through okay. But what I learned when I dove deeper into this topic and gut health, more importantly, is that a daily bowel movement doesn't mean that you're not constipated. Because it could be like you're not completely getting everything out. It could be that, you should be going more frequently. If you think about it, it's like sometimes you might empty 80%, but then you have about 20% retention in there that starts to kind of add up. And in a few days, the symptoms of constipation start to set in. So it really is like, the question should be going, are you having, a healthy looking bowel movement? And there's a Bristol stool chart that people, a lot of people use and can kind of judge what their bowels look like. And then the question is, are you having any of those other symptoms? Do you feel completely like you cleaned yourself out? And it should be very satisfying to have a good bowel movement. But so that's, I think, one of the myths that I learned about, or things that one of the nuances I learned about when I dove deeper into gut health,
Hmm.
for sure.
Yeah, you told me that recently you realized that rhythm is a really important piece.
Yeah, it really is. I think this is what sometimes they want to know what's causing my constipation, and it's a really fair question. I mean, who doesn't? And I know that was what drove me, honestly, to dive deeper into this because um, you know, I I struggle with constipation myself when I travel. And so you've heard of traveler's diarrhea, but there's also something called traveler's constipation. And, I knew that, your rhythm's sort of off, time zones are different, hydration's different, sleep and food is different. I just didn't know how big of an influence it actually had on my digestive rhythm. And so that was a huge eye opener for me. And I think that, it's one of those things that could be underlying what's going on. It's like you have to do your best to kind of stay in rhythm with your sleep and your food. Because here's the thing, if you're not eating, a lot of people skip meals. And I think that sets them up for, issues down the road because when you kind of start thinking about food and eating, it sort of triggers that whole motility through your gut. And so it's kind of like, what goes in, you kind of push it down, right? And it kind of triggers it to move forward. And so if you're skipping meals, then that's actually not happening. And so there's just many things that go into this whole rhythm aspect of it that is really overlooked, I think. So I think some of the other things that I see that can cause the constipation is, medications that you might not think about. Of course, I think everybody knows that, painkillers, like narcotics, certainly stop people up. But what I was surprised about is certain supplements. I mean, I always knew about iron, but calcium is one of those. And even antihistamines, and different, things like that. Certain blood pressure medicines can actually cause this kind of slower motility and constipation. So you want to kind of rule those things out. So, definitely see what you're taking medication wise and see if you can talk to your doctor and adjust those if you're having constipation issues. Um,
Yeah, it's almost more than nuance, right? Because so many people come in and they're confused as to why they're still constipated, even though they're drinking a ton of water,
yeah,
or they're eating fiber, or they're taking a fiber supplement like their doctor prescribed or told them to do. And it's because they don't realize there's more to digestion than just what you put into your gut. Obviously, that's super important, but like the timing, lifestyle, that gut brain axis, what's going on in your mind and your stress levels, hormonally as well, like all those things really matter. And even speaking to you, right, you are a dietitian, you're very aware of what you're putting in your body. When you travel, you notice how important those rhythms really are.
yeah.
And so if you're ignoring that, that's probably a big reason why you're still dealing with the issue. It's not just about, fiber intake or how much water you drink. You have to be considering these things kind of holistically.
Yeah, and I would even say, I think one of the mistakes I've made as a new dietitian, because we're just taught you have constipation, you eat fiber, and we're not taught the nuances. And that's why I think this podcast is so important, for people to start realizing that, because sometimes, if you are chronically constipated and you have like that moderate to severe constipation, it actually can make things worse initially because you don't have that rhythm yet that we talked about. And so for the person, that kind of just gets stopped up, maybe they ate or their lifestyle, they were traveling and adding a little extra fiber and drinking their water can get them going again. But if you're that person where it's like literally it's a log jam in there, we don't want to keep pouring more fiber onto it because everything just stays stuck. And then it's sort of this vicious circle of, you have the log jam and you have all this other food just kind of sitting in there. Now it's sort of fermenting and it's now creating methane gas. And that actually, slows things down even more. And so it becomes this sort of cycle of you want to kind of increase motility. So definitely adding in sort of a fiber supplement to kind of get that rhythm back in is usually helpful. And there's some good ones. I'm not talking about the stimulants so much. I'm talking about, maybe a psyllium husk or, some sort of prebiotic like that, that's sort of natural, that's going to help you get things going again. And then get back into those lifestyle things. So exercise makes a huge difference. Get out and just walk a little bit.
Well, why
Is
does
it
exercise make a difference?
Well, because it stimulates motility. And
Hmm.
so we
What
definitely
does
want
motility mean again?
motility gets things moving.
Right.
And so if you can add in 30 minutes a day of movement, and this is what I think really affects me is, if you're traveling, you're not moving as much. And definitely want to consider hydration. Hydration floats the log, okay? You want it to float, kind of help it along the way. And because the longer it stays in there, the stool stays in your colon, the more dried out it gets and then it's harder to move it along so that for that motility. I think that the other things I think is other point I want to make is that don't hold it. Okay. Don't, a friend of ours, when we go camping, hated the outdoor toilets. And so they would cork it. They called it corking it. And they would ignore their bowels completely until they finished, camping. And that really disrupts that rhythm. And so, if you're poop shy or you don't like using public toilets, we might want to work through that, because holding it really does disrupt that rhythm. And that's, again, if you're traveling, I think that's kind of what happens with that. So a few other things is how are you actually sitting on the toilet? So often, we don't want you to strain. We want you to relax, but how we sit on the toilet makes a big difference. And so if you think about how you would literally squat down, if you were camping or you backpacking and you have to go outside in nature, how you would literally squat. So your knees are above your hips, you're leaning slightly forward. That's because that makes it easier for you to actually go. That's sort of the profile or posture we want to duplicate on the toilet. but yet the modern commode doesn't really, accommodate that. So you have to kind of reenact that the best you can.
Yeah, that's squatty potty theory, right?
Yeah, and it's interesting. I think I, yeah, it helps people. I asked a pelvic floor therapist, physical therapist one time, and like, yeah, they actually do help because it helps you adopt that profile, that posture to go to the bathroom, but that alone, so you can start seeing that all of these things combined help you eliminate, right? Help you kind of navigate this constipation issue. And, um, the other things I think if you've done all these things, and I know there's a few of you out there, and I've had a client like this that we, went through all these things and we would get her going good, and then she would have some issues again. And, there might be more of what they call a pelvic floor issue going on. And I didn't even know that was a thing until I met a pelvic floor physical therapist. And I was like, I don't know, that's a thing. And they're like, yeah, I mean, so, sometimes you have to learn how to relax those muscles in your pelvic floor to help you, have a bowel movement. So that might be the next step for you if none of these other type of interventions actually work. And there might be some sort of structural thing going on too. So you might talk to your doctor about that.
Yeah, I'd say most of the time though, with the proper guidance, it's a problem that's very solvable.
Yeah, I mean, I would say the people I see, we get you going again, and it's never an issue again because we start looking at your lifestyle issues, we start looking at how you're eating, all of those things, and I can tell you if you're having a regular bowel movement, just you feel so much better. Everything, is so much better. So that's what we want people to, you know, to experience for sure.
Absolutely. Well, that's all we have for today. Unless you want to add something, Mom. You can find
No,
us
I
at
mean, this is really kind of a high level, really meant for you to start thinking about the fact that even if you have diarrhea, that it could be, from constipation, and that's not an uncommon thing, is that,
overflow diarrhea.
overflow diarrhea. Yeah. So, yeah, but no, it's great. I'm glad we talked about it. Who knew talking about poo could be so enlightening?
Yeah, so if you want to talk about more about this stuff, and we'll dive into deeper in different aspects of this subject and solutions, in later podcasts. But subscribe to the channel, hit the subscribe button, hit the notification bell so that you actually get notified when we post these things. And then you can always find us at therevitalizedcenter.com.
Hi,
Thanks, everyone.
everyone.
See you in the next one.